This is a 7-minute warning. We will do Q&A after remarks. Please press 1 to ask a question. This is a 2-minute warning. Please ask one to ask a question.
Thanks, everybody, for joining today's briefing on COVID-19 in North Carolina. UNC-TV is providing a stream for sign language on unctv.org. Well, good afternoon, everybody. As of today, we have 7,608 confirmed cases, 486 people in the hospital, and sadly, our death count continues to increase with 253 deaths. As always, our prayers go out to their families. Last month, our state took strong actions to slow the spread of this pandemic. We know that these actions saved lives, but we also know that we can't keep staying at home for the long run. Now we know what is needed to transition out of the restrictions and what a new normal will look like. This matters not just because people are anxious to leave their homes, but because this virus has hurt so many people economically. Last week, we laid out some general steps on the path forward. We need an increase in testing, more tracing, and we need our trends to be headed in the right direction. The White House shares similar guidance with states, and we have incorporated much of that guidance in our plan. After a thorough analysis of the details of testing, tracing, and trends, it's clear that we are flattening the curve, but our state is not ready to lift restrictions yet. We need more time to slow the spread of the virus before we can begin easing those restrictions. So today, I'm extending the stay-at-home order until May the 8th. This will include continued closure of dine-in restaurants and bars, as well as the same close contact businesses like hair salons, nail salons, movie theaters, and others that are in the previously signed Executive Order 120. It is important to get our economy moving, and we are helping with unemployment insurance payments, stimulus money, and many businesses that are continuing to be open. But I will not risk the health of our people or our hospitals. And easing these restrictions now would do that. This decision is based on data that we can see in our critical categories. I know people want their lives and their livelihoods back, and I have a plan to do that. But first, we need to hit certain metrics because the health and safety of North Carolinians is our #1 priority. I'll now recognize Dr. Mandy Cohen, who is our Secretary of the Department of Health and Human Services, to walk through the details of the data on testing, tracing, and trends that we are looking at, and then I will follow with the various phases that I believe North Carolina can go through once we hit the metrics that Dr. Cohen is outlining. Dr. Cohen?
Thank you, Governor. So I'm going to walk through North Carolina's data that's helping to inform our decision-making around easing restrictions and reopening.
Once we hit the metrics,
there's a warning, there's going to be graphs. So some people really like graphs, so if you do, you're welcome. For those who don't like graphs, I'm sorry, there's about to be quite a few of them. I'm going to walk through North Carolina. So on our first slide here, I'm going to go through a series of slides. Just a reminder that North Carolina has taken aggressive action to save lives. There's a warning. Our data has been driving our policies since day one because there's been no vaccine and no treatment. Data is clear that the strongest weapon we have to fight COVID-19 is social distancing. And Governor Cooper took strong, aggressive action early on to put social distancing at the center of what we were doing. So we have slowed the spread of the virus so fewer people get sick. And hospitals can care for those who are seriously ill. As you see on this curve right here, we have flattened. If you look at the light blue line, which is North Carolina, you can see that the trend of our line is below that of the United States. And that's a really good thing. We have flattened the curve, and thank you. That is the power of what we can achieve when we come together. It means fewer people are getting sick at the same time. Another way to look at this is that we have slowed the rate of acceleration of the virus. Something I've talked about before. It is taking longer for our number of cases to double. It's called the doubling time. It's something that is taking longer as we go. So when at first we were seeing a rate of acceleration of doubling every 4 days, we've lengthened that to 6 days, then 11 days, and that's seeming even longer now. So it's taking longer, and that's a good thing. So our rate of acceleration has extended. But the question is, where do we go from here? And that's what I want to talk through next. You can see we're doing a great job, and thank you. But we've talked about a path forward, and the governor mentioned testing, tracing, and trends. And so let's dive into the details of all of that. Let's start with trends. These are the 4 metrics that we want to look at in combination to know how to inform our decisions to ease restrictions. So there are 4 metrics, and then I'm going to dive into the data on each one of them, but let me go through each of these metrics first. So first is COVID-like syndromic cases over 14 days. That's our surveillance data. Second is our lab-confirmed cases over a 14-day period. Third are positive tests as a percentage of the total tests over 14 days. And lastly, a trend of hospitalizations over 14 days. So again, looking at those 4 metrics and looking at them in combination with each other to inform decisions to move forward. In addition to trends, we've been talking about testing and tracing. So on the next slide here, you see what we're looking at in terms of capacity that we want to see related to testing and tracing. That work has been ongoing since the start of COVID-19 response, but we want to see those increase. We want to look at tests completed per day. We want to look at our ability to conduct widespread tracing. And we importantly need to see the supply of our personal protective equipment be there for our healthcare workers and first responders. So those are our capacities that we need as well to move forward. I will say that our healthcare systems have done a fantastic job of being able to surge their capacity in order to be responsive to our work. So let's dive in to the trends, more graphs. So our first trend that I talked about was the trajectory of COVID-like syndromic cases. Again, this is part of our surveillance work. It's something that's posted on our website and updated weekly. And this is when someone comes to the emergency room with a symptom of COVID-19. So we're able to pick that up even before we get a COVID-19 positive test. We're able to say, did someone come into a healthcare setting with the symptoms of fever or cough or shortness of breath or need oxygen therapy? This gives us the earliest read on where things are in terms of what's going on in our healthcare systems. And as you look, you should be looking at our yellow line. That's what I want to draw your attention to. And you'll see at the end of this graph, the yellow line is going down, and that's a good thing. That's the trend we want to see. The thing I want to point out about this data point, and I'll do that for each of these metrics, is there's a limitation, as all data has limitations to it. This data point is driven by people seeking care. And it's good to know that folks are seeking care for things, but in the world of COVID-19, how folks seek care may be different than how they have sought out that care in the past. So we're still learning more about this surveillance metric, but an important one as an indicator for us. And again, it is declining, so that is good news. The next data point in our trends that we're going to look at are the trajectory of cases. This is something you see every day on our website. It's the number of laboratory confirmed cases. You heard the governor just share our total number of cases since the start of COVID-19. So this is data you've seen before, and you can see day to day we have a varying amount of new cases that are reported. What I want to draw your attention to is the yellow line. That helps us understand the trajectory of those cases. What that yellow line is called a 7-day average. So on any given day, we go backwards 3 days and forwards 3 days and look at an average to help us understand and smooth out a line to understand, are we going up, are we going down, or are we staying level? And you can see when you look at this graph, we started low, we were rising, and what we are largely doing now is leveling, and I would say increasing slightly. What you will see is today we reported 388 new cases since yesterday. I'm going to talk more about the fact that this has been one of our second highest day-over-day new cases that have been reported, but that's an important point as we look at overall testing cases. So what we want to see here is a decline. It's what the White House guidance says, is that you want to see a decline in this trajectory. We do not see that yet. And in fact, like I said, today is one of the second highest days of reported new cases that we have seen. But let's look at cases in another way, because we know as we increase the amount of testing that we're doing, and we are increasing that testing, we have to understand tests in a context. So let's go to the next slide. We want to understand how many tests are we doing that are positive as a percentage of the total amount of tests that we're doing. This is where the math lovers out there are going to understand that as we do more tests, we will find more COVID-19. So we want to look at what is that positivity rate as compared to the total. That's what this graph is showing us. Again, I will draw your attention to the yellow line, another 7-day rolling average, to help us understand trajectory of the percentage of these tests that are positive. And so what you'll see is largely this graph is slightly up or level. What we want to see from this graph is a decrease in this trajectory. We don't see that yet, but let me draw your attention to the last 2 days, because this is, I think, why we want to be looking at this metric in combination with the last. We know over the last 2 days has been some of our highest day-over-day testing days. We usually were averaging about 2,500 tests per day. The last 2 days, we've been somewhere between 5,000 and 7,000, which is where we want to be. That's a good thing. But as we test more, we know we'll find more. So what you're seeing even in the last 2 days is the percentage positive tests is going down. And that's a great thing. We haven't yet seen that become a trend, but it's a good early sign. Another limitation on all of this testing data that I just want to point out to folks is that you know that these are only as good as the lab tests that we have, meaning that we know folks are not all getting tested if they have COVID. We know that there's asymptomatic folks who are out there who have COVID-19, but also we don't universally get all of the lab data from every single laboratory. We get the vast majority of that data, but we're only able to report the percent positive from those labs that are reporting to us. Again, it's the vast majority, but it's still, there's a limitation there, and it's good to know that all of these data points have their own limitation. Okay, the fourth data point is about hospitalizations. We want to get a sense and be watching how many folks in North Carolina are sick enough that they need to go to the hospital to get the supportive care that they need. Again, I'll draw your attention to the yellow line, which is the 7-day rolling average. And what I would say here is largely we've been level. We've been in about 400, in the 400 range for hospitalizations. We know that our hospital system has more capacity than this, so this is a good sign. Now, we would love to see this trend downward, but leveling is also a good sign to see that we are not increasing a need for our hospitalizations in North Carolina. Let me point out a limitation on this data. The way this data is reported to us at the state is a daily count of the number of people who are in hospital with COVID-19 right now. So that means day to day, we know people are still in the hospital. We know they're there for multiple days. So they're counted in each one of those days. So you should note that this data is not new people admitted to the hospital each day. Rather, it's giving us a picture of how many people are in the hospital today and how is that changing. And again, largely, there has not been a downward trajectory, but we've been approximately level. All right, that was the 4 data points that we are looking at, the 4 metrics under trends. Let's come back to what do we want to see related to testing and tracing, those capacities that we want to continue to build. One I've touched on, testing. We've been talking a lot about needing to ramp up testing. And frankly, North Carolina has been a leader compared to other states, and I think it's one of the reasons that we are in as good position that we are as a state in terms of slowing the spread of the virus. But we need to do even better. We want to make sure that we're testing more folks. We were averaging about 2,500 to 3,000 tests. We want to see that be closer to 5,000 to 7,000 and even higher as we go forward with testing. So those are our near-term goals. Again, we saw some of those high days of testing just in the last 2 days, so that's really good progress. We want to see even more. The next part is about tracing. As we've talked about, those are the detectives that once someone is found to be positive with COVID-19, those are the folks that get in contact with them and find out who they may have exposed, who is at highest risk of that exposure, medium risk, low risk, and make sure that folks are doing the appropriate things of quarantining and doing the appropriate things to make sure they're getting folks tested. We have about 250 people who do that work right now through our local health departments. We'd like to increase that to 500 people. We are working to find a partner. We hope to be able to announce that either tomorrow or early next week with a partner who will help us surge that workforce and integrate that into our local health departments who have been leaders and been doing this all along. We also want to be deploying a digital tracing technology, and so our team is looking for the best of the digital tracing technologies out there. We know Apple and Google are looking to support maybe 2 or 3 of these, so we'll certainly be looking to them as we go forward. And then the last is about availability of personal protective equipment, things you've heard a lot about. We want to make sure that we have the ability to have PPE for all those who need it. The way we calculate this and think about it is how much is available for the next 30 days and how much does the state have that is able to fill requests. So the availability of PPE is calculated based on an average number of requests to the state for the last 14 days compared to the supply that the state has on hand. You will see new data posted on our dashboard today that sort of lays this out. The bottom line is that we do have a 30-day supply for some of our critical PPE needs, but there are 2 areas in which we do not have a 30-day supply. That's gowns and N95s. You can see more of that on our dashboard. So again, a metric that's improved certainly over the last number of weeks, but is still a work in progress. Okay, let's put all those pieces together. As we go on to the next slide here, what's our scorecard for today? Where are we? To recap on trends, we see that the trajectory of COVID-like syndromic cases over the last 14 days is going down. Great, green check. When we look at trajectory of cases over 14 days, we're still going up. That's not where we want to be. Next, the trajectory of positive cases as a percentage of total tests over those days. Again, that is something that is leveling, which is good, but we want to see that go down. We're seeing early positive signs, but we're still not there yet. And then the fourth metric around the trajectory of hospitalization, it's largely been level but not decreasing, so not there yet. On the capacity, we talked about the testing, tracing, and PPE as works in progress. Again, a lot of positive signs, but not there yet. So let's think forward to May 8th and beyond. Where do we need to go from here? So we're going to keep looking at these same trends and the same capacity. What do I want to see as we go forward? You'll see for COVID-like syndromic cases, we want to see that continued good decrease. So that's what we're going to be looking for. As far as number of cases, we want to see a decrease or a sustained leveling. This is where we deviate from the White House guidance. We want to make a modification from that White House guidance that says you should be decreasing. And that's because we believe a sustained leveling will also allow us to start to ease restrictions. And the reason for that is because of all the hard work that North Carolina has done to slow the spread. Because of the governor's aggressive actions, because of all of your hard work to stay home, we have not seen a surge of cases, and that's great. We have not seen a peak. We have not seen our healthcare system be overrun, and that's a good thing. So we're in a slightly different place. So we're not going to see a peak that then necessarily comes down. What we may see in North Carolina is a sustained leveling, and that sustained leveling will also allow us to move forward with some of this reopening. We want to see sustained leveling, and we use that word intentionally because we need to see that over a period of time to make sure that we are heading in the right direction and something is not going to sneak up on us and risk public health. So again, that's why we've added sustained leveling to how we're thinking about some of these metrics. Same thing with hospitalization, want to see that sustained leveling as well. And the percent of positive tests, we do want to see a decrease there. Capacity issues we went through already related to testing capacity. We want to see that be consistently between 5,000 and 7,000 a day. This is where our testing surge work group and all of the attention paid to make sure we're increasing testing is going to be really important. Contact tracing, as I mentioned, want to get up to 500 tracers. And PPE, again, we want to get all those gowns and N95s in our hands so that we can move forward. So what I want to leave you with is a hopeful note. I want to make sure you know that the hard work you've been doing has meant that North Carolina is in a very good place. We have flattened the curve, but we're not there quite yet. So hang in with us as we continue to look at these metrics. We look at building our capacity, and with working together as a state, we're going to get there and we're going to be able to move into some phased reopening. I'm going to turn it back to the governor, who's going to talk you through what that phased reopening could look like. And thank you so much again for all that you're doing to set us up to move forward. Thank you.
Thank you, Dr. Cohen. I appreciate you and our team's careful work to make sure that we're able to make the best use of data and science available to guide our decisions. That decision-making process also included members of the business community who provided input on how they can safely operate, and their input will continue through this entire process. We've developed a three-stage plan to move forward that stimulates the economy while protecting our health. And while the stay-at-home order will continue until May the 8th, I want to share some details of our plan so people can understand more about how we will gradually ease these restrictions. The first phase will look something like this when we've hit the benchmarks that Dr. Cohen described earlier. The stay-at-home order in phase 1 will remain in place, but it will be modified to allow more reasons to leave home, including commercial activities at any business allowed to be open, such as clothing stores, sporting goods stores, bookstores, and other kinds of retailers. That will open more opportunities to go out safely without the restriction of only going out for needed supplies. Now remember, those retailers and services will still need to implement social distancing for their employees and their customers, plus enhanced hygiene and cleaning, and to screen their employees for symptoms. And in phase 1, mass gatherings are still going to be limited to 10 people or fewer. But our parks can reopen in phase 1 so long as they follow the mass gathering limitation. And our outdoor exercise will continue to be encouraged. Face coverings will still be recommended in public when social distancing isn't possible. And in this phase and other phases, the same restrictions will remain in place for nursing homes and other congregate living settings, because we know that that's different. It's a confined community. This virus is going to still be with us, so we have to be extra careful. So after a minimum of 2 to 3 weeks has passed and we continue to hit our marks and benchmarks, we can enter phase 2. Here, the stay-at-home order can be lifted, but we will still encourage the vulnerable populations, those people who are most at risk of becoming seriously ill. We'll encourage them to continue to stay at home. Our houses of worship, restaurants, bars, and other businesses can open their doors for people as long as they operate at reduced capacity. the number of people allowed at a mass gathering will be increased. So then, after a minimum of 4 to 6 weeks has passed, and we continue to hit our marks and our benchmarks, we can enter into phase 3. In this phase, the guidance for vulnerable populations, those at risk, they will continue to loosen. There'll be increased capacity for bars, restaurants, and other businesses, entertainment venues, and houses of worship. The mass gathering ban will increase to allow more people. In all of these phases, as I said earlier, strict rules will continue to apply to nursing homes and our congregate living facilities. It's important to know that as we move through these phases, if our infection spike or our benchmark trends start to move in the wrong direction, we may have to move back to a previous phase in order to protect public health. As we're doing now, we will continue to use the best science and data available to make those decisions and continue our consultation with business and industry leaders. I know the people in our state are eager to move forward, and we will get there. But right now, I appreciate everyone who is taking this seriously and staying at home to protect themselves and others. Now, we know we won't go back to the way we lived in January or February of this year anytime soon. We need a vaccine, and we need more ways, such as antibody tests, to determine our level of immunity. But if we keep protecting ourselves and go back to work and play carefully, we can rebuild the damage that this virus has done to our state. North Carolinians are tough. We've been through trying times, and I know that we will tap that resiliency to look out for each other, encourage each other, and support each other as we beat this virus, and we will beat this virus. Dr. Cohen is with me today to answer questions. Also, we have with us our Secretary of the Department of Public Safety, Eric Hooks, our Emergency Management Director, Mike Sprayberry. Our sign language interpreters are Cameron Larson and Monica McGee, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. And I'd like to ask Secretary Hooks and Director Sprayberry to come forward. And now we will take questions from the media. If you can identify yourself and your organization, we would appreciate it. And we'll start with the first question.
Our first question will be Justin Hinton, WLOS.
Hello, Governor. This is Justin Hinton with WLOS in Asheville, North Carolina. Earlier in the week, you said an announcement about schools was coming. Can students, parents, and educators expect a return to in-person instruction before the end of the school year?
We want our schools to be safe and our children to be safe. And I am so proud of our teachers, teacher assistants, cafeteria workers, bus drivers, our parents, people who are working so hard to make sure that children can get as much remote learning as they possibly can get and are getting the school nutrition that they need. We have been consulting with educators and parents and others, and tomorrow we will have an announcement. I will have education leaders here. We will tell you about what we plan to do with schools in North Carolina, and that will be tomorrow afternoon. Thanks. Next question.
Sarah Ovaska, North Carolina Health News.
Hi, Governor and Secretary Cohen. This is Sarah Ovaska from NC Health News. I've heard from some providers about concerns that the test that they're using for COVID-19 may not be accurate, in that they're receiving negative tests where the patients that they're seeing seem to be exhibiting signs of what they feel might be coronavirus. Can you talk at all about this and whether this is a concern that you all might be having, or if that's discussions about whether the negative cases that we're seeing are in fact negative?
One of the things that is different about COVID-19 and these tests is that a test had to be created to be able to identify COVID-19 to start with. And remember, as we were waiting in February, the CDC said that it was going to provide a test for us, and we were waiting for that test, as were public labs in other states. It turned out when that test was sent to us in other states that it was an invalid test, and the CDC had to go back. And it's one of the things that put everybody behind in creating tests. We then turned to private labs like LabCorp and Quest, and our UNC and Atrium stepped up, and Novant, and many organizations in North Carolina began to form their own diagnostic tests that had to be verified. We know that many of them are out there now. We now have the rapid test done by Abbott that has a lower accuracy rating than some of the other tests, and there is in development now and has started of self-administered tests, which will be great whenever we can get that and get it mass produced and out there. Right now we're not there yet, but when that happens, we won't have to have as much personal protective equipment to make sure that we can have the diagnostic test done. But there is concern because there's so many tests out there that we may not be getting some good tests. And this is particularly true with not the diagnostic test, but the antibody test. There are a number of those now that are out on the market, and the FDA in some cases is relying on the manufacturer's assurances that they have cleared the testing and that the antibody test is good. These tests are going to be important to tell us how prevalent the spread of the virus is in our communities across North Carolina and across the country. But there have been real concerns about some of those tests being invalid. We obviously want to use the very best tests. We obviously want accurate information. Dr. Cohen can probably give us some supplemental information on that.
Well, Governor, you covered that exceptionally well. So what I would just say is that any diagnostic test we know has some false negative rate. The PCR test, the one that identifies the virus that we largely use now, is able to identify the virus at very low detection levels, which is very good, meaning it's very sensitive. But there are other newer tests, as the governor mentioned, the Abbott test, the rapid test, that have different kinds of sensitivities. We just need to know that going in, because I do think that different tests are needed for different types of circumstances. And so we'll try to diversify the kinds of tests that we're using in order to make sure we're getting good information for patients. To any clinicians out there, fellow doctors, use your best clinical judgment. If the test is wrong and you know that person has COVID-19, send another test, or just tell them you have COVID-19. Please stay isolated. Use your best clinical judgment so that we keep the virus contained. Thanks so much.
Thank you, Dr. Cohen. I went the wrong way. I'm used to having you on that side, so I have to remember that. All right, thank you very much. Our next question, please.
Travis Fain, WRAL.
Yes, thank you. Travis Fain at WRAL. What about allowing hospitals, particularly maybe rural hospitals, to do elective procedures? Where does that fall in the phase plan?
Dr. Cohen talk a little bit more about this, but we know that we've all done a good job at flattening the curve, and we've done a good job with available hospital beds, which was something that we wanted as we anticipated the surge. And Dr. Cohen has asked our hospitals to come forward with a plan. When we're talking about elective surgeries, most of these surgeries are needed, like hip replacements and things like that, where they need to be done. It just isn't time sensitive. So I think where we want to make sure that people are healthy across North Carolina is that they can start a limited situation of doing more elective surgeries, but also increasing attention to other illnesses and chronic illnesses out there. There are a number of providers out there that aren't seeing patients right now, and we're concerned that there are some conditions that people may have that have not been detected, or that they're not being treated for their chronic conditions. And we need an overall strategy while we fight this battle of COVID-19 that we can keep people healthy in other ways, because when we're staying at home and we're trying not to catch the virus or give it to other people, sometimes other illnesses are ignored, and we don't want that to happen. And so Dr. Cohen is working with our hospitals and our healthcare providers on a plan, and she might want to talk to you a little bit about that.
Thank you, Governor. Just one more note on that is just to thank the hospitals for all the work they've done to surge their capacity. And yes, we're working with them on a plan. Again, we want to make sure we have enough personal protective equipment to make sure that if we were to see more virus here in North Carolina, that everyone would be able to respond. So the hospitals are coming back to us with a plan on that, and how to make sure we have enough PPE on hand, as well as what would be the right trigger points for saying, actually, we need to potentially dial back again if we see a resurgence of more virus. So again, I thank them for that work, and we will be collaborating with them going forward.
Thank you. Next question, please.
Dawn Vaughn, News and Observer.
Hi, this is Dawn Vaughn with the News and Observer. Thanks for taking our questions. I wanted to ask more specifics about phase one and what specific business restrictions would be lifting starting May 9th, and how is the state currently enforcing the restrictions that we have now?
Well, first, we need our indicators to be moving in a positive direction as we approach May 9th to make a decision potentially to go into phase one shortly thereafter. And I outlined the differences with phase one and what the current order is. It expands the reasons that you can leave home for the stay-at-home order and can do more shopping, retail, other businesses. We think this will encourage more businesses to open. Parks are going to reopen, and we want to continue to encourage with the exercise. Phase one is beginning the process of moving forward, and we're going to look at our determinants and determine whether we would enter into phase two after that. I think for the most part, and we see it in the results, North Carolinians have done a pretty good job in abiding by the orders and really trying on their social distancing. I think we're one of the best states in the country for particularly the population that we have, with the success that we have had. We have had law enforcement. I think law enforcement's been good about this too. Law enforcement might see a violation or report a violation, and many of these have been handled by law enforcement going up and talking to people and say, hey, you know, you guys need to break it up. You don't need to be more than 10 people gathered, or other potential violations of the order. And we expect that to continue, and we hope that North Carolinians will continue to take this seriously and will continue to abide by the orders as we go through this process. And when we do get into phase one and then get into phase two, we want people to pay attention to that. As I said earlier, this virus is going to be with us until we have a vaccine. So we're going to have to continue to be careful and live in a different way. We want to get our lives back to normal as much as we possibly can, but we also want to keep public health and safety as the number one priority. So as we go through these phases, we hope people will pay attention to that and take advantage of the expansion that will occur in these phases, but be careful at the same time. Thanks. Next question.
Garrett Bergquist, Spectrum News.
Good afternoon, Governor. Garrett Bergquist with Spectrum News. Regarding the outbreak we're seeing at the chicken plant in Siler City, are you concerned at all that this could develop into another hotspot like we're seeing in other states, most notably the Smithfield plant in South Dakota? And what is the state doing to try to address this outbreak and other potential outbreaks in areas like that?
We're very concerned when there are outbreaks either at a congregate living facility or in a place of employment where people are working together. Public health officials have been working closely with the employers and the employees to do testing and contact tracing and making sure we try to isolate people and to deal with the virus in that way and to provide more education for people to try to avoid these kinds of things, and employers might have to change the way they do business. So yes, we are concerned about it, and we hope employers can learn from each other about ways to protect employees. And Dr. Cohen may want to add to that.
Thank you, Governor. I'll just add that the food production plant is obviously a heavily regulated industry by the Department of Agriculture. Commissioner Troxler and myself and others have been very engaged in talking to the corporate entities of folks, as well as have strike teams on the ground working with folks. What I'd say is they are doing very well at following our public health guidance. They've been using masks for their employees, putting up barriers, slowing down production lines, and getting folks testing as well as sick leave to make sure folks aren't coming to work sick. So I feel very encouraged about the progress that has been made, and that they are following the public health guidelines and working closely with the Department of Agriculture to keep those very important food production lines going, not just for North Carolina, but our country and our nation. So I think they're doing good work. Obviously, we'll keep our eye on that closely to provide any assistance that we can. I do want to distinguish what we're seeing at some of our food plants from the difference that we see in a congregate setting where someone can't leave, right? In our nursing homes, our patients don't leave. In our prisons, folks don't leave, which is different than in the food plant. We know that the virus is spreading in our communities. It's here in North Carolina. And so likely folks are picking this up, not necessarily at the plant, but potentially at home and in their communities. It goes back to why we need to all be thinking about staying at home and slowing the spread of the virus. We all play a part in this, and so I just thank everyone for their efforts.
And this is a moment to thank the people who are on the front lines, and particularly those who are in the food supply chain. It is so necessary for us to keep the food supply chain strong, and grateful for all the employees, the companies, the farmers, the people who are working so hard to do that. Thank you. Next question, please.
Alex Andreev, the Charlotte Observer.
Good afternoon, Governor Cooper. Thank you for taking my question. Several officials have contacted your office asking you to amend your executive order to allow NASCAR to run a race without fans at Charlotte Motor Speedway on Memorial Day weekend. What's the latest on your decision to allow NASCAR specifically to do the Coca-Cola 600 in mid-May and reopen its shops? And would you consider easing your restrictions for the sport to return before that phase 3 timeline you mentioned?
Thank you. NASCAR is home at North Carolina. We are the home of NASCAR, and I'm so grateful for this amazing sport that is in our state, that not only provides people with a lot of entertainment, but also is an amazing economic engine for our state. I've been in contact with NASCAR officials, track owners, team owners. They have come forward with a plan to try and protect their employees, a proposal that there would be no fans in the stands. Right now, our public health officials are examining their proposals. They're also talking to local governments there. There are garages in several counties around Charlotte, Cabarrus, Iredell, and Mecklenburg about how they would run their garages and to get the cars ready. They need a couple of weeks ahead of time. So we'll be coming forward with an announcement on that pretty soon after we have had more conversations with the public health officials and with NASCAR officials. Thanks. Next question, please.
Lake Wood, WASW.
Yes, Governor Cooper. My name is Lake Wood. I'm with WASW 8 News out of Fayetteville. My question is surrounding nursing homes and extended living facilities not being transparent about COVID-19 cases. We were actually told about an alleged case of this happening at a nursing home in Harnett County. What consequences can these facilities face, and how can people report this type of thing happening?
We have put forth a strong executive order requiring rest homes and nursing homes to put in extensive protections for their employees, and that's critical. But I'll let Dr. Cohen address that question specifically.
Sure, thank you. And yes, as the governor mentioned, it is so important for our nursing homes to do the proactive work to prevent the virus from getting there. But we know the virus is with us in North Carolina, so we know that this is incredibly hard. We know folks who may be working at nursing homes may be carrying the virus and don't show symptoms. We know many of the nursing homes are doing daily screenings of their employees. They're having employees wear masks all the time. But this virus is very contagious, and it's why we've been doing the hard work we have. And we continue to make sure that we are tracking all of these, providing the support that we can from the state as well as the local public health level. I'd say there's been a very good partnership between the nursing homes, the association, and all of the hospitals. Right, this is a team effort to really do the work to protect folks as we go forward, and so we will continue for this to be a top priority for us.
Thank you. Next question, please.
Andrea Blanford, ABC 11, WTVB.
Hi, Governor Cooper. It's Andrea Blanford with ABC 11. Aside from restaurants and bars, which you outlined could open in phase 2, can you be more specific, please, with what types of businesses would be among the first to reopen in phase 1? Are we talking about gyms, salons? And what specific protocols, if any, would be rolled out for those businesses when they reopen? Thank you.
We're working with all businesses right now on taking the appropriate social distancing measures to protect not only their employees, but customers who would come in, particularly in retail establishments. In phase 1, you won't see any of the businesses opening that are now closed by executive order. However, under our current order, we have many more identified essential businesses than some other states. And with the changing of the stay-at-home order, there'll be more opportunities for people to be able to leave their homes and to patronize these businesses that we want to continue to practice proper social distancing to protect their employees and customers. But we think that this will be, yes, a small step, but it is an important step to begin getting the economy going in a safe way. And if all of the indicators work and we move into phase 2, then these other businesses like restaurants and bars and hair salons and nail salons, those kinds of things would be a potential to open up under some reduced capacity or with special restrictions regarding social distancing, which we will continue to be working on. And we hope we get there as soon as we possibly can. The idea here is to make sure that we've got as good a control as we can on this virus, to make sure that we're leveling or decreasing in all of these important indicators, that we've got a handle on it in order to increase the economic activity that's going on, get more people back to work, do it in a smart, sensible way. And we look forward to working with all of these businesses that are affected, the employees and others, as we form these regulations and orders, as we go into phase 1 and phase 2 and phase 3 for that matter, to make sure they are done with public health in mind, but also to continue to push our economy forward. We know that a lot of people are hurting out there. We know that many people really want to get back to work, but I think most people understand that we need to be safe about it, not only for the people who are going back to work, but also for the customers involved and their families, because once you pick up this virus, everybody you come in contact with can potentially be infected, and that's why we have to be extremely careful. Thanks. Next question, please.
Michael Hyland, WNCN.
Hi, Governor. This is Michael Hyland from CBS 17. Just to be clear, by extending the executive order to May 8th, is it your expectation now that North Carolina would be able to begin phase 1 on May 9th? If not, based on the data you've shown and the increased testing capacity you say you're looking for, when do you all project to begin phase 1?
We will rely on the science, the data, and the facts, and on the indicators that Dr. Cohen presented. Between now, I guess today's 22nd, 23rd of April and April 8th, that gives us a 15 or so day window for us to look at all of the trends from these indicators that she just talked about to determine whether we can enter into phase 1 after the end of the order on May 8th. It may be that we don't meet those benchmarks and we aren't able to do it immediately, but it will depend on the facts and it will depend on the data and the science, and we're hoping that things will do well. We want people, it's going to depend on North Carolinians too, because they got to keep staying home, keep practicing social distancing. We're working hard to ramp up our testing and our contact tracing. We're going to do all of those things and hopefully move through these phases as quickly as we can, but we're not going to go to another phase unless it's safe to do so and our objective indicators tell us that it is time to do so. Thanks. Next question.
This will be our final question. Jenna Fryer, the Associated Press.
Hi, Governor. Thank you. It's Jenna Fryer with the Associated Press. As a follow-up to the NASCAR question about the Coca-Cola 600, there are a handful of southern states that have invited NASCAR to come race there without spectators. Can the teams get into their shops if they are able to socially distance and get the cars out and travel to other states to compete?
From the information that I have now, already under our state executive order, they could begin working in their garages as an essential business defined under our executive order. They are still in contact with local health departments that local governments may have some different health restrictions. We're also reviewing, the public health officials like Dr. Cohen and Dr. Tilson are reviewing the proposals put forth by NASCAR regarding the Coca-Cola 600 and how it would be run at the Charlotte Motor Speedway without fans, and they are examining that, and decisions will be made on that very soon. We are grateful to the people of North Carolina for your hard work. We appreciate this opportunity to present this plan to you. We would encourage people to continue to stay safe, stay at home, and look out for each other. And we will be back tomorrow to talk a bit about our schools and how we plan to move forward with that, and also what we expect regarding the General Assembly and the budget coming forward. Thanks very much for being with us. We appreciate it.